Hello, my name is William Fitzgerald. Today we're going to be talking about the primary survey of the patient assessment. For the primary survey, we're going to start off to verbalize the general impression using the acronyms FEDSO, WARF, and Patriotic Patient. So let's start off with FEDSO. We're looking for what are the patient's facial expressions? Do they make any eye contact? What's their dress and hygiene like? Do they speak when they're approached? And do they have any odor? Second, we're going to use the acronym WARF, which is going to be used to determine their work of breathing. How many words per sentence can they say? Do they have any abnormal sounds or positions? Maybe try having the patient use the phrase, "You can't teach an old dog new tricks." Next, we're going to look for any retractions. And finally, is there any nasal flaring? Next is patriotic patient. We're going to use this to determine the skin. Is the skin red, white, or blue? If it's red, it may indicate a fever, a sunburn, an allergic reaction, or possibly carbon monoxide poisoning. If it's white, it may show signs of shock or anemia. And finally, if it's blue, your patient is showing signs of cyanosis. Next on the primary survey, we're going to determine the responsiveness or level of consciousness of the patient using the AVPU method. Is the patient alert? Is the patient responsive to verbal stimuli? Is the patient alert to painful stimuli? Or is the patient unresponsive? Next, we're going to talk about the chief complaint or apparent life threats. And we need, if needed, treat those life threats. Who called EMS and why did they call us? The next step is to assess the airway. Is the breathing too slow, too fast? Are there any abnormal sounds? Also, is it open and secure? We're going to be watching for chest equal rise and fall and assure adequate ventilation. And again, this assesses the airway and breathing. Next, we're going to assess circulation. So we're going to start off looking for any major bleeding. If any major bleeding is noted, we need to control that bleeding. And this is when we would assess our skin color, the temperature of the skin, and the texture of the skin. We're going to check for a pulse, starting off by feeling the radial pulse. If none is noted, then we're going to check the carotid pulse. If they have a carotid pulse, we're going to determine is it too fast or too slow. Next, we're going to assess disabilities using PERLA. Are the pupils equal, round, reactive to light? Or are there any accommodations? Next, we're going to expose the patient for examination and finally identify the priority of the patients. And this is when we will make our transport decisions. If it's critical, it's going to be a load and go scenario, and non-critical, stay and play. This concludes my video. Stop by next time for secondary assessment.